Hello guys, welcome back to Pharma Palette. So today in this video, we are going to discuss about the differences between the sympathetic and parasympathetic nervous system and their functions in detail. Previously, we have discussed what is a sympathetic and parasympathetic system, and now today we will be discussing about the differences between the sympathetic and parasympathetic and the main functions of both sympathetic and parasympathetic nervous system in detail. So without any further delay, let's get into the video. So the effect can be seen in eye. The effects can be seen in the pancreas, heart region, lungs. The effects are also seen in the stomach region. So, in the parasympathetic nervous system, the effect on the eye region is this will be useful for constricting the pupil. Similarly, in the sympathetic nervous system, the effect on the eye is this will be useful for dilating the pupil. The parasympathetic system will be useful for stimulating the saliva, whereas the sympathetic nervous system will be inhibiting the saliva. So, the sympathetic nervous system will reduce the salivation or inhibits the salivation. Then, coming to the third one, the parasympathetic effect on the heart is that this will be slowing the heartbeat, whereas the sympathetic nervous system, this will be increasing the heartbeat. Coming to the lungs, this parasympathetic system will be constricting the airways, whereas the sympathetic nervous system, this will be relaxing the airways. Then coming to the stomach, in the parasympathetic system, this will be useful for providing the stimulatory activity of the stomach, whereas the sympathetic system will be inhibiting the activity of the stomach. Now let's see some other organs and their effects on the body. So especially in the liver, stimulating the gallbladder, whereas the sympathetic nervous system will be inhibiting the gallbladder. Intestine portion. So if it is intestine, the parasympathetic system will be stimulating the activity of intestine. The sympathetic nervous system will be inhibiting the activity of intestine. Then after intestine, there will be kidneys. So the sympathetic nervous system will be useful for secreting epinephrine and norepinephrine. So this sympathetic system will be secreting the epinephrine and norepinephrine. And the last one is the bladder. So coming to the bladder, this parasympathetic nervous system will be causing the contraction of bladder, whereas the sympathetic nervous system will be relaxing the bladder. So that is all about the different organs in the body and the effects of sympathetic and parasympathetic effects on these organs. So these are the complete sympathetic and parasympathetic differences, their effects on different organs in the body. And for the functions also you can write the same thing, and for differences also you can write the same thing. So just remember it as each organ, then you can easily get the functions. So first is the eye portion. So in the parasympathetic, it will be causing constriction. Sympathetic causes dilation. Then coming to the saliva, the parasympathetic will be stimulating and the sympathetic will be inhibiting the salivation. Coming to the heart, this will be parasympathetic will be reducing the heartbeat, whereas the sympathetic system increases the heartbeat. Then coming to the lungs, this parasympathetic system will constrict the airways, sympathetic will be relaxing it. Similarly, stomach, the stimulation activity will be increased in the parasympathetic system. Here there will be inhibitory activity. And if it is liver, there will be stimulation of gallbladder in the parasympathetic system. And if it is sympathetic, there will be inhibition. And same thing, next one is intestine. So the stimulation in the intestine, the stimulation will be seen in the parasympathetic system and the inhibition in the sympathetic system. And coming to this kidney especially in the sympathetic system will be causing the secretion of epinephrine and norepinephrine. And coming to the bladder, this will be causing constriction in the parasympathetic system, and the sympathetic system will be causing relaxation. So mostly the constriction stimulation increasing rates will be seen in the parasympathetic system, and all the inhibitory effects can be seen in the sympathetic system. So that is all about the complete functions and the differences between both sympathetic and parasympathetic nervous system in detail. I hope this video was clear, and if you found this video helpful, don't forget to like, share and subscribe to Pharma Palette. See you all in the next video, and thanks for watching.